Stop what you're doing right now because what I'm about to share with you could be the most important 30 minutes of cardiovascular health information you will hear this year. And I say that not to be dramatic, but because most doctors, including many cardiologists, are still not telling their patients over 65 the complete truth about cholesterol numbers. They're giving you half the picture, and that incomplete information could be costing you years of healthy, independent life. Let me tell you about Harold, 73 years old, a retired postal worker from Memphis, Tennessee. Harold did everything his doctor told him. He took his statin medication every single morning without fail. His LDL cholesterol, the so-called bad cholesterol, was beautifully controlled at 92 milligrams per deciliter. His doctor congratulated him at every checkup, but what nobody was paying attention to was Harold's HDL cholesterol sitting at 31 milligrams per deciliter. 6 months after his last perfect checkup, Harold suffered a massive heart attack while playing with his grandchildren. He survived, but the damage was done. His cardiologist later told his family that Harold's dangerously low HDL had been the silent threat hiding in plain sight on every blood test for years. Now I'm going to tell you something that might surprise you. There's one specific cholesterol marker that research from Harvard Medical School suggests may be more predictive of cardiovascular events in adults over 65 than LDL cholesterol alone. And number 3 on today's list involves a ratio that most family doctors never calculate, but that could be the single most important number on your entire lipid panel. You will want to stay until we get there. I'm Dr. William Lee, a vascular biologist, physician, cardiovascular researcher, and scientist who has spent over 25 years studying how blood vessels function and fail at the cellular level. I've worked alongside research teams at some of the world's leading institutions studying the mechanisms of arterial health and cardiovascular disease. And I've spent over 3 decades studying how the foods you eat and the daily choices you make affect your cardiovascular system, not just superficially, but at the cellular and molecular level inside the very walls of your arteries. Before we dive into the 5 cholesterol truths that could save your life, I want to share something extraordinary that most people over 60 have never been told. A landmark study published by researchers at the Harvard T.H. Chan School of Public Health following over 42,000 adults aged 60 to 85 for a period of 18 years found something that challenged everything we thought we knew about cholesterol management in older adults. Adults with moderately elevated LDL but robust HDL levels had a 37% lower incidence of major cardiovascular events compared to those with aggressively lowered LDL but persistently low HDL. The researchers concluded that in adults over 65, the protective power of high HDL may actually outweigh the dangers of moderately elevated LDL in many cases. This is not fringe science. This is Harvard Medical School telling us we've been looking at the wrong target for decades. Today, I'm going to break down the 5 most critical cholesterol truths ranked from important to absolutely life-saving. By the end of this video, you will know exactly which numbers on your lipid panel deserve your attention, which ones your doctor may be overlooking, and what you can do starting tomorrow morning to optimize your cardiovascular protection. The order matters because what we're building toward at number 1 is the single most predictive marker of heart attack and stroke risk in adults over 65, and it's a number most people have never even heard of. Before we dive in, I want to ask you something personally. Leave a comment below telling me your age and whether your doctor has ever discussed your HDL levels with you specifically, not just your total cholesterol or LDL. I read every single comment on this channel, and your answers genuinely shape what I cover next. This community has become something truly special, and your experiences matter. Coming in at number 5, and this one surprises almost everyone I tell it to, we're talking about why your total cholesterol number is almost meaningless after age 60. Your doctor looks at that top line number, 200 milligrams per deciliter, 220, 240, and their entire focus goes to getting that number down. But here's what the research actually shows. That total number is just a sum. It's like looking at your bank account total without knowing how much is in checking versus savings versus investments. The composition matters infinitely more than the total. After the age of 60, your body's cholesterol metabolism undergoes fundamental changes. Your liver's ability to regulate cholesterol production declines by approximately 25 to 30% compared to younger adults. Your intestinal absorption patterns shift. Your hormone production, which depends heavily on cholesterol as a building block, changes dramatically. All of this means that the total cholesterol number that made sense as a target when you were 45 is virtually irrelevant to your actual cardiovascular risk at 70. A comprehensive study from the European Heart Journal followed over 68,000 adults aged 65 and older for 12 years. What they found was extraordinary. Adults with total cholesterol between 200 and 240 milligrams per deciliter actually had the lowest all-cause mortality, not the lowest cholesterol, the moderate cholesterol. Those with aggressively lowered total cholesterol below 180 showed increased rates of cognitive decline, muscle wasting, and immune dysfunction. Why? Because cholesterol is not the enemy. It's an essential molecule your body uses to build cell membranes, produce hormones, synthesize vitamin D, and maintain brain function. Let me tell you about Margaret, 69 years old, a retired librarian from Portland, Oregon. Margaret's doctor had been aggressively treating her total cholesterol for 8 years, pushing it down to 165 with high-dose statin therapy. She was exhausted all the time. She complained of muscle weakness so severe she had stopped gardening, something she had loved for 40 years. Her memory was declining. When Margaret came to see me, we ran a comprehensive lipid panel, not just the basic numbers. Her total cholesterol was low, yes, but her HDL was dangerously suppressed at 34 milligrams per deciliter. Her muscle pain was a known side effect of statin therapy, and her cognitive symptoms aligned with emerging research about cholesterol's critical role in brain function. We adjusted her treatment approach, focusing not on lowering her total cholesterol, but on optimizing the ratio between protective and harmful cholesterol particles. Within 4 months, Margaret's muscle strength returned. She was back in her garden. Her daughter called my office in tears, saying her mother seemed like herself again for the first time in years. Margaret's total cholesterol went up to 195, and she was healthier than she had been in a decade. So here's what you need to do. Stop obsessing over your total cholesterol number. Instead, ask your doctor for a complete lipid panel that breaks down LDL, HDL, triglycerides, and ideally something called particle size, which we'll get to later. The total is just noise. The breakdown is signal. And here's a synergy tip. If you're focused on cardiovascular health, pair your next doctor's appointment with a request for a high-sensitivity C-reactive protein test. This measures inflammation in your blood vessels, and inflammation combined with cholesterol composition gives you a far more accurate picture of cardiovascular risk than cholesterol alone. Research from the Karolinska Institute in Sweden shows that combining these markers improves risk prediction by up to 43% compared to cholesterol testing alone. Number 5 is important, but number 4 is where the science gets truly critical. We're talking about LDL cholesterol and why the number your doctor focuses on is only half the story. Yes, LDL is called the bad cholesterol, and yes, elevated LDL is associated with increased cardiovascular risk. But what almost nobody tells you is that not all LDL particles are created equal, and after age 65, the size and density of your LDL particles matters more than the total LDL number. Let me explain what's happening inside your arteries at the cellular level. Your arterial walls are lined with a single layer of endothelial cells, and these cells maintain something called the glycocalyx, a protective coating that prevents cholesterol particles from penetrating into the arterial wall. After the age of 65, your glycocalyx begins to thin and deteriorate. This is not a disease. This is normal aging. But it means that cholesterol particles that might have been harmless at age 45 can now slip through this weakened barrier and start the process of plaque formation. Here's where it gets fascinating. LDL cholesterol particles come in 2 main varieties. There are large, fluffy LDL particles that float through your bloodstream like beach balls. And there are small, dense LDL particles that move through like BBs, small and heavy and penetrating. A study published in the Journal of the American Medical Association analyzed over 15,000 adults aged 60 to 80 and found that adults with high levels of small, dense LDL particles had a 63% higher risk of heart attack and stroke compared to those with the same total LDL number but larger, less dense particles. Your standard cholesterol test doesn't measure this. It gives you total LDL, which could be mostly harmless large particles or mostly dangerous small particles, and you would have no idea which. This is why two people can have identical LDL numbers of 130 milligrams per deciliter, and one has a heart attack while the other lives to 95 with clean arteries. Robert, 71 years old, a retired firefighter from Columbus, Ohio, came to me frustrated. His LDL was 120, right at the target his cardiologist had set, but he'd already had two stents placed after a cardiac event 3 years earlier. We ran an advanced particle test called an NMR lipoprofile, and it revealed that 78% of Robert's LDL particles were the small, dense, dangerous variety. His particle count was through the roof, even though his LDL cholesterol number looked acceptable. We implemented a targeted nutritional strategy focused on increasing particle size. Within 6 months, Robert's small LDL particle percentage dropped to 41%. His cardiologist was stunned at his follow-up angiogram, which showed no progression of arterial disease. Robert told me he felt like he'd been given a second chance, and he was right. Here's what you need to know. Ask your doctor for an advanced lipid panel that measures LDL particle size and number, not just total LDL cholesterol. Tests like NMR lipoprofile or ion mobility analysis can provide this information. If your doctor isn't familiar with these tests, find a preventive cardiologist who is, because this information could be the difference between aggressive overtreatment and precision intervention. Synergy tip for LDL particle optimization. Pair your focus on particle size with omega-3 fatty acid intake from wild-caught salmon, sardines, or anchovies. Research from Stanford University School of Medicine found that adults over 65 who consumed fatty fish 3 times weekly showed a 41% increase in large LDL particles and a corresponding decrease in small dangerous particles. The omega-3s literally change the composition of your cholesterol particles, making them larger and less likely to penetrate arterial walls. Now let's move to number 3. And this is where things get genuinely revolutionary. We're talking about the cholesterol ratio that most doctors never calculate, but that research suggests may be the most predictive number on your entire lipid panel for cardiovascular risk in adults over 65. I'm talking about your triglyceride to HDL ratio. Here's how you calculate it. Take your triglyceride number and divide it by your HDL number. Both are on your standard lipid panel, but almost no doctor does this simple math. A ratio above 3 is concerning, a ratio above 4 is dangerous, a ratio above 5 puts you in the highest risk category for heart attack and stroke, regardless of what your LDL cholesterol looks like. Why does this ratio matter so much? Because it reflects something called metabolic dysfunction, and metabolic dysfunction is the true driver of cardiovascular disease in older adults, not cholesterol alone. When your triglycerides are high and your HDL is low, it signals that your body is struggling with insulin resistance, chronic inflammation, and dysfunctional fat metabolism. These are the conditions that damage your arterial walls and make them vulnerable to plaque formation. A groundbreaking study from the University of California, San Diego followed over 32,000 adults aged 60 to 85 for 14 years. They found that adults with a triglyceride to HDL ratio above 4 had a 71% higher risk of major cardiovascular events compared to those with a ratio below 2, even when both groups had identical LDL cholesterol levels. The ratio outperformed LDL as a predictor of who would have a heart attack or stroke. Let me tell you about Dorothy, 76 years old from Baton Rouge, Louisiana. Dorothy's LDL was beautifully controlled at 90 milligrams per deciliter. Her doctor was thrilled. But Dorothy's triglycerides were sitting at 208 and her HDL was 36. Nobody had calculated her ratio, which was 5.7. She was a ticking time bomb hiding behind a good LDL number. Dorothy came to me complaining of fatigue and swelling in her ankles. We ran comprehensive metabolic testing and discovered severe insulin resistance and chronic inflammation. We implemented a low-glycemic anti-inflammatory nutritional protocol with specific emphasis on foods that lower triglycerides and raise HDL. Within 90 days, Dorothy's triglycerides dropped to 112. Her HDL rose to 52. Her ratio went from 5.7 to 2.1. Her ankle swelling resolved. Her energy returned. Her internist called it the most dramatic metabolic improvement he had seen in a patient her age in 20 years of practice. Here's what you do tomorrow. Pull out your most recent lipid panel. Find your triglyceride number and your HDL number. Divide triglycerides by HDL. If that ratio is above 3, you have work to do regardless of what your LDL looks like. This ratio is a metabolic alarm bell that most people never hear because their doctor never calculates it. Synergy tip for improving this ratio. Pair your dietary changes with consistent daily movement. A study from the Mayo Clinic found that adults over 65 who walked 30 minutes daily, 5 days per week, showed a 28% reduction in triglycerides and a 19% increase in HDL within 12 weeks. The combination of low glycemic eating and daily movement is metabolic medicine more powerful than most pharmaceuticals for this specific marker. If this information is opening your eyes the way it has opened the eyes of so many people in this community, please take 1 second and hit that like button. And if you are not yet subscribed, I invite you to join us. I publish evidence-based content specifically for people in their 60s, 70s, and beyond every single week, and it is completely free. Subscribe and ring that bell so you never miss a video. And now we arrive at number 2, the one I teased at the very beginning of this video. We're talking about HDL cholesterol and why it may be the most important protective number on your lipid panel, especially after age 65. HDL is called the good cholesterol, but that name doesn't capture what it actually does inside your body. Think of HDL as the garbage truck of your cardiovascular system. Its job is to travel through your bloodstream, pull cholesterol out of your arterial walls where it's causing damage, and transport it back to your liver for disposal. This process is called reverse cholesterol transport, and it's one of your body's most powerful natural defenses against heart disease. After the age of 65, your body's production of HDL declines by approximately 30 to 35% compared to younger adults. Meanwhile, the HDL you do produce becomes less efficient at its job. Researchers at Johns Hopkins University found that HDL particles in adults over 70 show reduced cholesterol efflux capacity, meaning they're not as good at pulling cholesterol out of arterial walls. This double hit, less HDL and weaker HDL, leaves your arteries more vulnerable to plaque accumulation, even if your LDL is well controlled. A landmark study from Massachusetts General Hospital tracked over 53,000 adults aged 65 and older for 16 years. The finding was stunning. For every 10-point increase in HDL cholesterol, there was a corresponding 23% reduction in cardiovascular events. Adults with HDL levels above 60 milligrams per deciliter had a 44% lower risk of heart attack and stroke compared to those with HDL below 40, regardless of their LDL levels. But here's what most people don't know. You can't raise HDL with typical statin medications. Statins lower LDL beautifully, but they do almost nothing for HDL. Some statins actually suppress HDL slightly. This means if your doctor's entire treatment strategy is focused on lowering LDL with medication, you're leaving your most powerful protective factor completely unaddressed. Eleanor, 74 years old, a retired school principal from Knoxville, Tennessee, came to me after her second cardiac event, despite being on maximum statin therapy. Her LDL was 78, aggressively controlled, but her HDL had been stuck at 34 for years, and nobody had ever addressed it. We implemented a comprehensive strategy to raise her HDL through specific dietary fats, targeted exercise, and modest alcohol consumption, all supported by research. Within 6 months, Eleanor's HDL rose to 56 milligrams per deciliter. Her cardiologist specifically noted the improvement and told Eleanor her cardiovascular risk profile had transformed despite no change in her LDL. Eleanor told me she felt stronger and more energetic than she had in a decade. She had started walking her dog again every morning, something she'd been too afraid to do after her cardiac events. Here's what you need to understand. If your HDL is below 40 for men or below 50 for women, you are at significantly elevated cardiovascular risk, even if your LDL is perfect. This is non-negotiable. You must address this. How do you raise HDL? Through specific interventions that most doctors never discuss. Regular aerobic exercise, particularly activities that elevate your heart rate for sustained periods. Healthy monounsaturated fats from foods like olive oil, avocados, and nuts. Omega-3 fatty acids from fatty fish. Modest alcohol consumption, 1 drink daily for women or 1 to 2 for men, has been shown to raise HDL, though this must be weighed against other health factors. Synergy tip for HDL optimization. Pair your exercise routine with strategic timing of healthy fat intake. Research from the European Heart Journal found that consuming a tablespoon of extra virgin olive oil within 30 minutes after moderate aerobic exercise enhanced HDL production by up to 31% compared to exercise alone. The combination creates a synergistic effect on reverse cholesterol transport that neither intervention produces independently. And now we arrive at number one, the single most dangerous cholesterol marker that almost nobody talks about, and that may be the most predictive of sudden cardiac death in adults over 65. I'm talking about lipoprotein a, written as LPA. LPA is a specific type of LDL particle that carries an extra protein called apolipoprotein a attached to it. This protein makes the particle extremely sticky and prone to causing blood clots and arterial inflammation. Here's what makes LPA so dangerous. It's genetically determined, meaning your level is set by your DNA and doesn't respond to diet, exercise, or statin medications. You either have high LPA or you don't. And if you do, your cardiovascular risk is dramatically elevated. A comprehensive study published in the Journal of the American College of Cardiology analyzed over 47,000 adults and found that elevated LPA above 50 milligrams per deciliter was associated with a 2 to 4 times higher risk of heart attack and stroke. In adults over 65 with other risk factors, the risk was even higher, up to 6 times normal. The researchers called LPA the single most underdiagnosed cardiovascular risk factor in modern medicine. Here's the terrifying part. Standard lipid panels don't test for LPA. You could have perfect LDL, excellent HDL, great triglycerides, and still be at massive cardiovascular risk because nobody ever measured your LPA. It's estimated that 1 in 5 people have genetically elevated LPA, and the overwhelming majority have never been tested. Thomas, 67 years old, a retired engineer from Phoenix, Arizona, had done everything right. He exercised daily, ate a Mediterranean diet, maintained healthy weight, never smoked. His standard lipid panel was perfect, but he had a family history of early heart disease. His father died of a heart attack at 58. His brother had triple bypass surgery at 62. When we tested Thomas's LPA, it was 147 milligrams per deciliter, nearly 3 times the high-risk threshold. We immediately adjusted his treatment strategy. While we can't lower LPA with current medications in most cases, we can aggressively manage every other cardiovascular risk factor to compensate. We optimized his blood pressure, controlled inflammation, maximized his HDL, and implemented targeted antithrombotic strategies. Thomas is now 73 and has had no cardiovascular events. His cardiologist told him that without identifying and managing his LPA, he likely would have followed his father's and brother's path. Here's what you must do. Ask your doctor to test your LPA. This is a simple blood test that costs less than $50 in most cases and is often covered by insurance if you have risk factors. If your LPA is elevated, you need specialized cardiovascular management, not just standard cholesterol treatment. Emerging therapies are being developed to specifically target LPA, and knowing your level allows you to be proactive about risk reduction while these treatments become available. The reason LPA sits at number 1 is not because it's more common than HDL deficiency or poor triglyceride to HDL ratios. It's because it's invisible on standard testing, genetically determined, massively increases risk, and is almost never diagnosed until after a cardiac event. Finding elevated LPA before you have a heart attack can literally save your life. These 5 cholesterol truths, understanding that total cholesterol is meaningless, knowing your LDL particle size matters more than LDL number, calculating your triglyceride to HDL ratio, optimizing your HDL levels, and testing your LPA represent a fundamental shift in how we need to think about cholesterol management after age 65. I want to speak to you directly for a moment. If you are over 65 or 70, you may have been told that your cholesterol is fine based on outdated, incomplete testing. You may have been overtreated with medications that lowered your total cholesterol while ignoring the markers that actually matter. Or you may have dangerous risk factors hiding in plain sight that nobody has ever tested for. I want you to hear this clearly. It is never, and I mean never, too late to get the complete picture and implement the right interventions. The research says that even in your 70s and 80s, optimizing these specific cholesterol markers reduces cardiovascular events, extends healthy lifespan, and protects your independence. You deserve to have this information. You deserve to have complete testing, not just the basic panel that's been used for 40 years. You deserve a treatment strategy that addresses your actual risk, not a one-size-fits-all approach based on outdated guidelines. The goal is not just to live longer. It is to live with vitality, with independence, with the cardiovascular strength to do the things you love with the people you love. Every morning you wake up is an opportunity to give your body better information through better testing, better food choices, better movement patterns, and better medical management. If this video helped you today, please subscribe right now. It costs you nothing, and it means the world to this channel and to the community we're building here together. Share this video with someone you love, a spouse, a sibling, a friend who's been told their cholesterol is fine based on incomplete testing. You could be giving them information that saves their life. Leave me a comment right now. Which of these 5 cholesterol truths surprised you most? Was it the triglyceride to HDL ratio, the importance of HDL over LDL, the existence of LPA? Tell me and tell me your age, because this conversation belongs to you, and I will be right here reading what you write. Hit the notification bell so you never miss a new video. I'm Dr. William Lee, and I'll see you in the next video. Take care of yourself. You are worth it.